The Wellbeing and Aged Care program is based in residential aged care facilities. We provide one-to-one and group therapy with older people. We do a lot of talk therapy, so it's based on supporting their mental and emotional well-being. They're a fairly isolated population in Australia and they need a lot of support.
YourLink partners with organisations such as villages and home care providers and residential aged care organisations to design and deliver digital skills programs that support seniors, carers and care workers.
The COVID pandemic has really affected our population in residential aged care facilities. We're finding that their anxiety has gone up a lot higher. They're not able to get in contact with family as they normally would. Oftentimes their aged care homes go into lockdown, and unfortunately this means that the residents are in their rooms often for longer periods of time. They're not socialising with the other members of the facilities. When they are having interactions with staff, the staff are wearing head to toe PPE, so face masks, shields, glasses, coats. So they're quite isolated.
We've all seen how important digital skills and digital access has become, and particularly for those vulnerable, such as seniors and carers. YourLink's really excited to be partnering with the Community Options Australia team for the Wellbeing and Aged Care program. Our role is to bring their program into the digital world and to support the residents and care workers with the skills that they need.
It's really important that residential aged care homes build up these digital skills for older people, because we know that social connection is actually one of the huge factors that helps prevent things like depression and reduces the risk of dementia and helps reduce anxiety.
When we were designing the Wellbeing and Aged Care program from the digital perspective, YourLink really took into consideration the factors that were affecting the staff that we were working with. So we needed to think about the fact that they were time poor and make sure that we were just providing them with bite-sized pieces of learning, that they could come, learn that piece, go back to their jobs and do what they needed to do, and then come back later and ask us questions. Learn a bit more and then go back and see if they could implement some of that during their week. And we've had great success.
Measuring the impact of a program like this, we want to think about the reach of the staff members that we're supporting and training, and then how they're going to use it in the homes that they're working in. So for example, some homes have 100 people, 200 people, and so being able to help those staff members support all those residents in different ways really demonstrates the impact a program like this can have.
One great example I have of the impact of this program was when one of the lifestyle team members came along to our entertainment and interests module, and they learned about podcasts. They realised that not only could the residents use this individually, but they could also have a group activity using the podcasts. They had a meeting the next day with the residents, showed them the podcasts up on the screen, which is all audio, but the whole group enjoyed them so much that they decided to put this as a weekly activity.
For us, it was really important to select a company that had such great expertise in transforming a face-to-face program therapy model into a virtual program. YourLink has so much experience in the digital space, and they were able to translate that really easily, and they did a lot of great work working with the residential aged care facilities themselves and making that model flexible for the staff.
What I love about the program is that it can really work in a range of different contexts. Retirement villages, home care providers, carer programs. I think there's a great opportunity to be working with organisations across the country. Everyone can benefit from the access digital skills provides in terms of social connection and mental health outcomes.